After the floods in Balochistan in 2022, we all received reports of many disease outbreaks and a very high mortality rate for each disease or condition. We'll take if all the unreported and reported cases join them together, there is a significant enough data to alert all the concerned authorities and UN agencies and other organizations working in the humanitarian field.
They had such severe acute malnutrition. Their MUACs, the mid-upper arm circumference readings were on red, and red means risk of death. So you have to work very quickly. So we have a lot of work now to do in Balochistan to save the lives of the babies, but also of the mothers. There was malnutrition with the mothers. And Pakistan has the best food. And it's really important that we can support the nurturing care program so women and children can not only survive but thrive.
After the floods, we established Raja Razakar and trained volunteers to visit communities, go there and identify high-risk children and women. Many of our volunteers visited many such marginalized and hard-to-reach areas, flood-affected areas, especially in Nasirabad division, including the Kachi district. We screened every child of 6 months to 5 years old in these communities through mid-upper arm circumference measurement. The results of our screening activities were quite heart-wrenching. Every second child in these communities was severely malnourished. The prevalence of malnutrition was recorded to be more than 50%.
So in Balochistan, the community built their own, with community effort, nurturing care hut. And it's the first in Pakistan. And it's really innovative because it is a WHO UNICEF framework of health, nutrition, early learning, as child, safety and security, and responsive caregiving. And we know when we do these 5 things, children and the mothers too, they thrive. So in a future emergency, and sadly we will have many more emergencies with climate crisis, the community are empowered to deal with their crisis. So it is a wonderful achievement. So I salute Pakistan for that, and I'm excited to continue supporting, and I hope everyone will support this project.
The idea is to establish nurturing care huts in each community with a trained, skilled person to oversee a cluster of 15 to 20 villages. We provide the design of the hut. Community elders help us arrange the free labor from the same community and build the hut using locally available materials. This is a self-sustainable system with minimal external support. Raji Razakar and Breastfeeding International will enable mothers to take care of themselves and their children. We will do it through establishment of community-level mother support groups, periodic and need-based counseling, promotion and protection of breastfeeding practices, and nutrition education for the mothers to prevent or treat malnutrition at home using locally available foods and good dietary practices.
Now I fear that more than 60% or 70% of population is badly affected. Especially I am focusing for under 5 age of children and those vulnerable segment of the community. I just look at that like the food sources or food commodity sources were destroyed during floods, and the land which was cultivated to produce food has been affected by the flood. So in upcoming year I am also feeling food insecurity. So Balochistan, as per the National Nutrition Survey, figure of the Balochistan were honorable. 50% population was food insecure before the flood. Now flood made it very worse situation. So I just can assume that 80% of the population is food secure nowadays, and fluctuation in dollar rate also made this situation very worse.
देखिए कंपनी हमारे यहाँ आज भी जो इन्होंने चेकअप किए काफ़ी बच्चों का, तो उसमें तो अपने बच्चों को सेहतमंद, हमें तो लगा हमारे बच्चे सेहतमंद हैं, लेकिन जो इंटरनेशनल स्टैंडर्ड्स है या जो उनके मुताबिक है वो हमारे बच्चे उतने सेहतमंद नहीं जितना हम उनको महसूस कर रहे हैं। तो हम इंशाल्लाह कम्युनिटी हमने आज है हम सब ने मिलकर, हमारे जितने भी यहाँ के मोतबरी ने, जितने नोटेबल्स और जितने दूसरे गाँव से लोग आए हुए हैं, हमने ऐद किया है कि इंशाल्लाह हम इस जो इनका काज है इंशाल्लाह इसको एक जंग समझ के हम इंशाल्लाह लड़ेंगे। और इंशाल्लाह हमसे इन्होंने वादा किया है कि इंशाल्लाह 15 गांव में ये अपने सेंटर स्टेबल करेंगे और वहाँ में इंशाल्लाह डॉक्टर भी प्रोवाइड करेंगे। हमने इनके साथ वादा किया है कि जो भी हमारे ज़िम्मे काम लगाएंगे इंशाल्लाह हम अपना फ़र्ज़ पूरा अदा करेंगे, क्योंकि ये हमारा फ्यूचर का मसला है, हमारे मुस्तकबिल का मसला है, हमारे बच्चों का मसला।
ये बेहतरीन तरीक़ाकार उसने मतलब इशू किया है ताकि इलाके के हमारे बच्चे और बच्चियाँ मतलब सेहतमंद और खुशहाल रहें। और ज़्यादातर सिलसिला ज़माना है जो बच्चों को माँ की दूध का हर जगह हर इलाके में ये सिलसिला कमी हुआ है। सिर्फ खुराक का ये डब्बे वगैरह या ये बैल के दूध या बकरी के दूध या ये सरकारी जो मतलब मिलता है वही दूध पे गुजारा है। इसी वजह से हमारे इलाके के बच्चे बहुत कमज़ोर हैं। सेहत की वजह से छोटे लेकर बड़े तक मतलब ये इनका सेहत बराबर नहीं है। फिर ये इलाके में ऐसा कोई सिलसिला ज़माना नहीं है, क्योंकि डॉक्टर है या अस्पताल है, ये है वो है, कोई मतलब मेडिसन का सिलसिला नहीं है। ये सारा देहाती इलाका है। इस इलाके में जो है तकरीबन मतलब ये सिस्टम हेल्थ की नहीं है, नाकामी है। यहाँ मतलब डॉक्टरी वाला सिलसिला ज़माना नहीं है कि बच्चों को मतलब कोई तरीक़ाकार खुराक का बतावे। ये खुराक भी अपना मतलब ये सिलसिला डिस्पेंसरी आज शहर में उसे जाओ वो लिख करके देता है, भाई मतलब ये डब्बे वाला खीर दो, दूध दो या फलाना चीज़ दो, फलाना चीज़ दो, वही सिस्टम है। अक्सरियत तकरीबन मतलब कुछ नहीं कह सकता हूँ, माँ का दूध है नहीं तो सारा सिलसिला ये है, सारा ये पाउडर है और ये डब्बे है, या बैल का दूध है या बकरी का दूध है।
I as a social activist suggest that government, non-development organization, political organization must come forward and play their role. Government must bring some food commodities with the help of international community, and NGO must the NGO or the private sector must support the community, and community must play their role to produce their food commodity.
Now we have launched an intervention to treat these malnourished children and women who are identified during community visits. Our intervention is not only to treat these women and children, but also to prevent malnutrition from prevailing again in these communities. We have launched our intervention with the technical support of Breastfeeding International. The essence of this intervention is to empower the communities so that they take charge of their own health and well-being.
So my suggestion is that we must protect, promote and support breastfeeding, because breastfeeding prevents malnutrition in all its forms. This is the evidence base. And breastfeeding is a team effort. It's not a one-woman job. It requires the grandmothers, the fathers, the community leaders, even youth. And it's a team effort. Breastfeeding is a team effort, and that includes the government. Pakistan has a great law, the breastfeeding promotion law, and it must be implemented and it must be enforced with sanctions, because what we're seeing is companies undermining breastfeeding for profit. And our children are our VIPs. This is so important. And if we really want to reduce malnutrition, if we're serious about that, then we must protect breastfeeding and also local, nutritious, indigenous, local foods.